Outrage erupts as the BBC plans to spend a staggering £650,000 of public license fee money on private healthcare for its employees. A move that's sparking fierce debate. But here's where it gets controversial. While millions of taxpayers struggle with record-long waits for NHS appointments, the BBC is prioritizing its staff with on-demand remote GP services. Is this a justified investment in employee well-being, or a tone-deaf misuse of public funds? In an exclusive report, critics have slammed the decision as indefensible, arguing that it highlights a growing disconnect between the BBC and the public it serves. The broadcaster is set to award a lucrative contract to a private firm, offering employees and fixed-term workers access to virtual GP appointments via phone or online platforms. This scheme, slated to run from February 2026 to January 2029, with a potential extension to 2031, comes at a time when NHS wait times are at an all-time high. And this is the part most people miss. Recent data from the House of Commons Library reveals that 12.9 million people waited over 28 days for a GP appointment in the first half of this year, a sharp rise from 4.5 million in 2021. The NHS has also warned that non-urgent treatments could take up to 18 weeks. William Yarwood, from the Taxpayers Alliance, didn't hold back. It's outrageous that while millions can't secure a GP appointment, the BBC is using license fee money to fund private healthcare for its staff. This two-tier system shows just how out of touch they've become. He joins a growing chorus calling for the license fee to be scrapped, arguing that it's unfair to burden struggling households with funding such perks. A TV industry insider added fuel to the fire. When the public can't get a GP appointment for love nor money, the BBC is giving its staff priority access. It's a slap in the face. The BBC, however, defends its decision, stating, "As a 24/7 global media organization, many of our teams work irregular hours in locations where NHS access is limited. Remote GP access is part of our duty of care to reduce sickness absence and ensure we continue delivering services for our audiences." But here's the question that's dividing opinions. Is the BBC's move a necessary investment in its workforce, or a blatant misuse of public funds? Should the license fee be overhauled? Or is this just another example of the BBC prioritizing its own interests over those of the taxpayers? Let us know what you think in the comments. This debate is far from over. ****